Hello and welcome to Ask the Expert. From medical questions to questions about surgery or just debunking myths, there are numerous medical questions we've set out to answer for you. For the past several years, 7 News, in partnership with Bon Secours St. has been getting answers to your questions. From the simple questions like how to get better sleep to the more complicated ones concerning cancer and screenings. This is 7 News' Ask the Expert. Let's take a look. All carbs are bad for you. Health experts say that's a myth. Late night meals will cause you to gain weight. That's also a myth. And eating healthy is too expensive. Well, you guessed it, it's also a myth. According to medical professionals, those statements are some of the most inaccurately shared concepts on social media.
One nutrition myth would be that carbohydrates are bad for you, but they are the body and especially the brain's preferred source of energy. With carbohydrates, it's really the quantity and the quality of the carbs that we choose to have.
Registered dietitian Brianna Grand says while there are some truths buried beneath those statements, they're commonly taken out of context by influencers.
Like someone that's promoting, cutting out an entire food group or drastically reducing calories. Some of those things can produce that short-term, quick fix that we're looking for, but it is usually not sustainable long-term and can even potentially be harmful.
Health experts say that also includes being wary of what people are trying to sell you.
Whether it's a supplement or, a service, a product, not to say that it's necessarily a bad thing or that everything they're saying is false, but it's important to just be aware of those biases that they may have.
There are some research-backed diets that health experts do promote.
We should focus on more of the fruits, the vegetables, the whole grains, those carbohydrates that have more fiber in them.
Grant says a well-balanced diet will benefit our bodies in the long run.
But also has, immediate effects of, improving the energy that you have throughout the day.
Health experts say to focus on what you eat. Is it processed? Is it high in sodium? If so, you may want to think twice.
It is one of those factors that we can control, right? Unlike other factors like genetics or age, we have no impact over that. But our diet, we can make healthier choices.
When a doctor confirms a new diagnosis,
it changes things.
Life as you know it could change. According to health experts, diagnoses are presented in different forms, including disorders, illnesses, and diseases, which is why opinions when determining treatment options matter. Dr. William Lawrence specializes in cancer.
In most people's lives, that's kind of the most significant healthcare event they've had. And the initial treatment for any type of cancer is very important. You want to ensure that you're treating that cancer in a guideline appropriate. You're following national guidelines and it's being treated correctly.
Those treatment options can vary whether it's cancer or another disease. Doctors say getting a second opinion could be beneficial to assure you're receiving the most accurate and effective plan. After all, the cost, length of therapy, and location are all under the microscope.
We encourage people to go get a second opinion if they want to. Now, the reality is not everybody wants to.
But what if you're afraid of offending your doctor?
I've heard stories of some people, some physicians maybe getting upset. I tell patients that's a warning sign. If somebody they're not okay with you getting a second opinion, then that would make me question.
Regardless of whether you decide to get a second opinion or not, doctors say it's a decision the patient needs to be comfortable with.
I encourage my patients, if they see me as the first opinion, I encourage them to get a second opinion. You've got to be comfortable with the physician, you've got to be comfortable with the treatment plan, because after all, it's your life and you want to make sure you're getting the best information possible.
And while some seek out 2, sometimes 3 opinions to weigh their options, doctors say more is not always better.
It's the kind of old saying, too many cooks in the kitchen ruin the stew. Listen, I did my fellowship at Memorial Sloan Kettering in New York, and there were some patients that I saw there that were on their 5th to 6th opinion on how to treat their prostate cancer. I personally think that's overkill.
But if that's what you need, then doctors say go without hesitation.
Patients, they need to do what makes them comfortable.
From mood changes to hot flashes, doctors say menopause is a normal sign of women aging.
Menopause is a time in life, usually around age 45 to 50, that all women experience when they have hormonal changes that make it so that they're unable to bear children at that point.
Upstate cardiology physician assistant Kelly Valetti says during menopause, women produce less estrogen, which is what researchers are connecting to cardiovascular disease. Here's why.
The hormonal changes at menopause change how your body stores and utilizes fat, so that you tend to gain weight mostly with abdominal fat. You get some belly fat. And that is what increases your risk for cardiovascular disease.
Doctors say those changes have an impact on women's overall health because the more weight you gain, the more issues people tend to have with their arteries, blood vessels, and other implications that impact how the heart operates.
The main thing that women need to do as they go through menopause to minimize the symptoms that they experience and to decrease their cardiovascular risk are to know their blood pressure, their cholesterol numbers, and their blood sugar. The sooner you have that information, the more you can stratify your risk and start treatment.
To help with that, health experts recommend following a nutritious diet and prioritizing exercise.
Small changes are going to really help with your decrease your cardiovascular risk. So if you normally eat 2 double cheeseburgers, if you can eat 1 and eat a little more vegetables with it, you have to know what is a reasonable goal for you. It's the same way with exercise. It's recommended to do 150 minutes of moderate aerobic exercise a week. But if you right now are only walking out to your mailbox once a day, a reasonable goal might be just walking to your mailbox three times a day.
According to the American Heart Association, heart disease is the leading cause of death among women in the U.S. And while it's not guaranteed you will develop cardiovascular disease during menopause, doctors say it's important to know the signs and how to maintain a healthy lifestyle. Even a small step in wellness is a step in the right direction. For this week's Ask the Expert, remember, you can find all of these stories on our website, WSPA.com. Just click on the Ask the Experts section. Right now, we're going to take a quick break and return with answers to more of your medical questions. We want to continue now with a look at doctors and health experts answering your questions. This is 7 News Ask the Expert in partnership with Bon Secours St. Francis. Focusing on the needs of others. It's a trait health experts say many people pleasers take too far.
It's like essentially like a behavioral pattern in which individuals will just prioritize the needs of others over themselves.
Bon Secours behavioral health therapist Justin Plant says when your mental or physical health begins to suffer, it's time to shift focus from helping others to helping yourself.
If you're always kind of overextending yourself for the needs of others, we can have increases in irritability and fatigue, sleep disturbances, as well as a lot of times folks with people pleasing will experience excessive guilt and anxiety around needing to continue to prioritize the welfare of others over themselves.
Doctors say most excessive people pleasers may not even notice the harm their actions and behaviors are causing. Health experts say it can lead to resentment and an unhealthy dependency on people, essentially putting your mood and how you live in the hands of others.
It's good to kind of analyze where's all that energy going, and if it appears it's going into kind of always planning and moving your life and your daily schedule and responsibilities around those of others to a large extent, then you could be people pleasing. And also is looking for those symptoms of burnout that accompany it.
People pleasing is all around us, in your social life, within your family, even at work. But how did we get here?
And usually it is an interpersonal type of trauma that creates people pleasing.
Plant says it's a behavior that can form for a number of reasons, but one of the most common has to do with past traumas, riddled with a deep-rooted fear of abandonment. But the good news, doctors say you can heal your people-pleasing tendencies by setting boundaries. Doctors say that includes your ability to say no and understanding your self-worth.
The best thing to remember is boundaries are for you, and it's not for the other person. So they may not understand the purpose of it, and that's okay.
Getting your body ready for pregnancy may look different for each person, according to health experts with the CDC.
So, general time frame is pretty individual. Most women start thinking about planning a pregnancy in their mid-20s. That's about the average, but we take care of pregnant women in their 20s, 30s, and even 40s.
Dr. Celeste Beaudoin, an OBGYN at Carolina's Women's Health, works directly with families for pregnancy planning.
As far as how long it can take to become pregnant, well, some couples it can take even up to a year.
Which is why she says it's important to start the planning process sooner rather than later, and that begins with seeing a doctor.
So coming in before you're thinking about starting the process is a good idea, just to make sure that you're not on any medicines that would hinder or be unsafe in pregnancy, and see if there's any health conditions that we can make sure that you're healthier with before starting.
Doctors say the mother's overall health is one of the most important parts of pregnancy. According to the CDC, smoking and drinking alcohol can cause issues, including birth defects, premature birth, and in worst cases, death. To ensure mom and baby get the proper nutrients, doctors recommend starting a vitamin.
It's always a good idea to be on prenatal vitamins before you start trying to get pregnant. At least a month is ideal. And so I usually tell women if they're going to stop their birth control, start taking a prenatal at least a month earlier than that. So making sure you're on one that has enough folic acid, at least 400 micrograms, sometimes more depending on your health, is a good idea.
Nutrition is not the only thing that mom should plan for ahead of pregnancy. Medical professionals say you should also keep an eye on your weight and prioritize moving your body.
So it's something that everybody has to talk about every time they come in, but at least having 30 minutes of exercise 5 times a week, somewhere between 150 to 200 minutes of exercise. If you can get in a regular routine of that and maintain a healthy weight while you're trying to get pregnant, then your pregnancy is going to go a lot smoother.
Overall health before pregnancy encompasses many things, even areas many tend to forget.
One thing that not everybody really thinks about is their dental health. And so not just seeing your doctor, but seeing a dentist and seeing if there's things that you can take care of, because we know that poor dental health contributes to a very high risk of preterm labor.
Whether you're pregnant or planning to grow your family soon, doctors say it's never too late to get back on track to prioritize your health for you and your baby.
An estimated 1 million people get shingles each year in this country, according to the CDC.
Shingles are a viral infection that causes a painful rash.
Family nurse practitioner Ruthie Craps says shingles is caused by the varicella zoster virus, which causes chickenpox.
So we're exposed to chickenpox, and then once that chickenpox resolves and that initial infection is gone, that rash is gone, we don't shed that virus. It actually stays in our body.
That virus lies dormant, but in some people, it reactivates later. That's shingles. Krabs says 90% of adults 18 and older have had chickenpox, making shingles pretty common, but says it's more often seen in older adults.
Shingles typically is presenting due to some sort of stress or some sort of immune deficiency. So as we age, our immune systems get a little bit weaker, and so it predisposes us to that recurrence or reactivation of the virus.
Shingles is not contagious, but a person infected with shingles can still make someone else sick.
Here's the thing. You have a rash that comes up, right? It's going to be, it has some fluid. When that fluid is touched by somebody else, they can potentially, if they haven't been vaccinated for chickenpox or they've never had chickenpox, they can certainly develop chickenpox, but they wouldn't develop shingles.
Kraps says it's important to take precautions to keep others safe if you have shingles.
If you have shingles, an active rash with fluid-filled blisters, you should really try to keep that covered. And if you do touch it, which you should try not to, if you touch it, you should wash your hands really well to avoid spreading those germs.
Shingles can be incredibly painful. Nurse Kraps says the best way to protect yourself is to get the shingles vaccine.
So if you are 50 and above, you can get the 2-dose series of the shingles vaccine. It's about 97% effective in that age group, and then once you hit 70 years of age, it's about 91% effective.
If you are immunocompromised, your doctor may recommend the shingles vaccine at a younger age.
Don't forget to submit a health topic to our Ask the Expert series. Go to our website, click the news tab, and look for Ask the Expert. It's simple. More of your questions answered by our Bon Secours St. Francis medical experts after this. Welcome back as we continue to get answers to your various health topics. We continue now with our partners at Bon Secours St. Francis. This is 7 News' Ask the Expert.
Adequate hydration just supports our entire body system in so many different ways.
From adequate sleep to mental clarity, registered dietitian Jalek Patel tells us there are a number of health benefits of proper hydration.
So being well hydrated is an essential part of good health. Think about water as an essential nutrient for our body, feeds every cell. And so we know that proper hydration supports risk reduction in constipation, in kidney stones, and then also bladder infections, because we know that water helps to flush out bacteria that's kind of sitting in that bladder.
Before your health takes a turn, experts say there are ways to recognize dehydration.
The telltale signs of dehydration, definitely thirst, skin's getting dry and flaky. You can also start feeling achiness in the body, loss of mental clarity. I can't think clearly. Your start getting really achy. Your joints are hurting. Urine color, of course, is a good sign if it's dark in color.
How much water is needed varies per person. Patel recommends her male patients consume at least 15.5 cups of water throughout the length of a day and 11.5 cups for women.
It also depends on what you're doing. If you're out and you're exercising and you're perspiring profusely, that amount of water we would encourage more of.
But if you drink or consume more, that's okay too. She advises you to just be wary how much you drink all at once.
There is a possibility of overhydration. And that risk, you could start feeling also fatigue, dizzy, low blood pressure if we're consuming too much water. So there is that risk.
There's a gut-brain axis or gut-brain linkage, if you will, where we are finding more and more data that our typical routine life does tend to affect our gut.
Medical Director of Gastroenterology at Bon Secours, Dr. Viral Oza, has been analyzing abdominal migraines for several years.
It's called a migraine because it comes in intermittent fashion, very similar to the traditional migraine.
The only difference, the pain is in your stomach. Dr. Oza says the most common symptoms include nausea, vomiting, and abdominal pain, often triggered by food.
Chocolates, citrusy fruits, that's something that's very commonly associated with abdominal migraine.
While migraines are more widespread among adults, doctors say stomach pain is more common among children. In a study by the National Institute of Health, medical professionals say the majority of children often overcome the condition by their teen years.
Adults very, very rarely will have abdominal migraines. I saw some few case reports in literature that exist on patients being diagnosed with abdominal migraines. Almost always, more than 90% of the time, it is in the pediatric population. And typically, like I said, age of diagnosis is around 7.
Medical professionals say diagnosing abdominal migraines can be a challenge, which is why it's important to keep track of what foods you and your child are eating and when the pain and discomfort occurs.
It's very hard to get a history from a child, right? I mean, think about it. If you're 7 or 8 years old child and your parent asks you what's wrong, you say it's hurting. Well, what's hurting? Everywhere. Where it's hurting? Here. So it's a very vague answer. So getting an accurate history from a child is very important.
Doctors say treatments are similar to how you would manage a regular migraine: drinking more water, taking pain medication, and limiting outside stressors. Health experts say most children will outgrow the pain. When illnesses or injuries arise, where do you go for care?
For most people, the right time to come to see a doctor or to seek care is if your condition is getting worse or at least not improving 24 to 48 hours after it starts. And definitely if you feel like it's starting to interfere with your quality of life or your ability to do things like go to work or go to school.
Dr. Matt Delfino is the Regional Medical Director at Bon Secours AFC Urgent Care. With more than a decade of experience in the health field, he's helped treat patients who walk through the door for a number of reasons.
We see minor illnesses and injuries. Most common types of things people come in for are upper respiratory infections like sore throat, cold, sinus infection. If they're concerned about things that they may need testing for like COVID, flu, strep, or RSV. Certainly minor injuries like cuts and sprains or breaks of bones.
If primary care is not available at the time you need help or the emergency room is not appropriate for your condition, doctors say an urgent care could be a safe option for immediate help.
You can walk in at any time. We have extended hours that most offices in primary care do not offer. The benefit of going to an urgent care versus an ER is really the shorter wait time and the less cost that you have on the patient.
Regional Operations Director of AFC Urgent Care, Andy Choi, says urgent cares cover everything from physicals to vaccinations, respiratory illnesses, and more.
Most of the services that are provided in urgent care could be provided in primary care, but we do a lot more like procedure-based care, such as incision and drainage, cuts that you may have. If you have a broken bone, then we can do x-rays in the center and provide splinting as well.
If you head to an urgent care, you may need to be prepared to share your medical history. That's something your primary care office would typically have on file.
If they're not available or their office is closed, we can get that information out of the medical record and we can treat you until you're able to get back to your primary care doctor.
If your condition gets worse over time or you have significant pain, swelling, or bleeding, health experts say it's best to skip the urgent care and head directly to the ER. That's a look at this week's Ask the Expert show here on WSPA Plus. Be sure to join us every Thursday on 7 News as we seek answers to your top health questions, and each week right here on WSPA Plus. For now, thanks for making an appointment with us.